Now let's talk about ectopic pregnancy. What is ectopic pregnancy? This is just a condition that occurs when a baby that was supposed to grow inside the womb now starts developing elsewhere. It can develop in the fallopian tube, it can develop around the ovary, it can even develop in the abdomen. Ideally, naturally, a baby is supposed to develop inside the womb. After the egg is fertilized, it's supposed to go in, travel through the fallopian tube and implant itself inside the womb. But for some reason, sometimes this happens and you find that the baby starts developing. I'm using the word baby, the term baby, so that you can understand me very well. Now, there are several causes of ectopic pregnancy, but let me just explain the phenomenon. So the fallopian tube does not have the capacity to stretch to accommodate a growing baby. Okay? That's why you even notice that even around the pelvic region, your womb is only the first 3 months, which is 12 weeks, that the baby can be in the pelvic region and nobody will even notice that you're pregnant. But from the 4th month, it will come up a little just before your navel. The 5th month, it comes just around your navel. The 6th month, it passes the navel a little, and that's how your tummy gets protruded. So within the first 3 months, the baby developing is still within the pelvic organs, but from the 4th month it enters into the abdominal region, because the abdomen has muscles that has the capacity to stretch to accommodate a developing baby. That's why you notice that no matter how long a person's abdomen protrudes during pregnancy, it will not burst open. So people carry twins and the abdomen will stretch itself enough to accommodate that twin. All right, so imagine a baby growing in a tube, in the fallopian tube. What do you think will happen? At a certain point, the tube will burst open, and once this tube bursts open, it is a medical emergency, because number one, there's going to be internal bleeding. The first symptom that lady is going to feel when there is rupture of an ectopic pregnancy is a very sharp stabbing pain. I'm not talking of menstrual pain, I'm talking of a stabbing pain. It will be so severe that it's not something you can ignore. Immediately there's going to be bleeding, internal bleeding, and most often you will see VJ bleeding as well, physically. And then there's dizziness immediately and the feeling of fainting. The person might just fall down and collapse, and it is a matter of urgency. That person needs to be put in the theater immediately, and the tube cut off. That particular tube that has ruptured is cut off immediately to save the woman's life, at least preserve the remaining tube. So in a case where somebody is pregnant and the person keeps going for regular antenatal, immediately you get pregnant, I always advise women, don't think because you've had up to 2 children, 3 children, you think, oh, I'm an old car girl, I know how this thing works now, I'm not going to go for antenatal until I'm 5 months gone. Different pregnancies come with their different challenges. Okay, so don't rely on your previous experiences. So if you have so for some women, you go to the hospital, register for antenatal as soon as you notice you're pregnant, and probably you start feeling some symptoms like pains and all that, and then you decide to go for a scan. The scan can actually detect that the baby is growing outside the womb. And once that is detected, the woman is very lucky, because the pregnancy will be terminated. They will place her on a certain medication to terminate the pregnancy, and then they will do some procedures to bring out the product of conception. But if you do not know, you're just waiting at home till you're 5 months gone, and all of a sudden there's just one day that the sharp stabbing pain happens, the woman faints, starts bleeding, and if she finds herself in a place where there was no means of getting a taxi or a boat to rush out to the hospital immediately, or you don't even have phone, or there's no network for you to even call someone to take you to the hospital, or if the person is even conscious enough to make a call or remember where the phones are, because this thing happens suddenly. The pain comes, bleeding comes, you fall down immediately, and you don't even realize yourself anymore. It is a medical emergency. For an ectopic pregnancy to rupture, that's the tube, the fallopian tube busting open because it cannot accommodate the growing child. One of that tube that has ruptured, that has burst open, is going to be cut off. But the good news is that people with one tube they've actually gotten pregnant. So don't give up. If you found yourself in this situation, or you know someone who has gone through an ectopic pregnancy and went through surgery that they cut off that one tube, the remaining tube you can also get pregnant with the remaining tube. Yes, you can have the number of children you would have loved to have if you still had your 2 tubes intact. We've got 2 tubes. As a woman, you've got 2 fallopian tubes. So if one is cut off because of an ectopic pregnancy that got ruptured, the other one can also serve the purpose. You can get pregnant with it. Now let's quickly dive into several causes or things that can predispose a woman to have an ectopic pregnancy. Number 1, women who smoke. As a young lady, oh, I'm not married yet, or I'm not ready to have a child yet, or I'm not even planning in the next 2 years, but someday you might likely want to get pregnant. Smoking affects the fallopian tube. Yes, it damages the fallopian tube. It can cause some blockage in the fallopian tube. And anything that blocks the fallopian tube, or anything that slows down the movement of the egg once it has been fertilized by the sperm, anything that slows down its movement from getting to the uterus or to the womb where it's supposed to implant and start developing as a baby, can actually lead to ectopic pregnancy. Because once the movement of the egg is slow, or it gets to a point and it cannot move further because there's a blockage in the tube, it cannot move, it will just stay there and begin to develop. It will stay there and begin to grow. But because the tube was not designed to accommodate a growing baby, there's going to be a problem. It's going to burst open. It's going to cause a serious complication, a life-threatening complication. So please stop smoking if you're a lady, as this can put you at a higher risk of developing an ectopic pregnancy in the future. Number 2, pelvic inflammatory diseases. And we all know what causes PIDs. Most often is STIs, that's sexually transmitted infections like your gonorrhea, chlamydia. All the sexually transmitted infections will lead to PID. That's pelvic inflammatory disease. And what does pelvic inflammatory disease really do to you as a woman? It inflames or makes all your reproductive organs to swell up. Your pelvic region swells up. It can cause your tubes to become blocked. It causes a lot of havoc in your reproductive tract or system as a lady. So please try to protect yourself always, and always do high vaginal swab to know if there's an infection. Please treat yourself as often as possible to prevent PID, because long-lasting PID left untreated will definitely affect your fallopian tube and predispose you to ectopic pregnancy in the future. Number 3, a woman who has gone through some pelvic surgeries before. For example, somebody who has had surgery on her ovaries. Maybe you had a cyst and they did surgery to remove the cyst. Maybe you've had fibroid and they opened your womb to remove it. Maybe you've got any condition that actually, you've gone through a pelvic surgery before. Scar tissues can form in the process of healing of those organs, reproductive organs. Scar tissue can form, adhesions can form, and actually slow down the movement of a fertilized egg from getting, or block it from getting to the womb, which can predispose you to ectopic pregnancy. Another cause is a woman who has actually had an ectopic pregnancy before. Yeah, this is really, I'm being realistic now. For if a lady has had an ectopic pregnancy before, there's a tendency that she may likely have an ectopic pregnancy again in subsequent pregnancies. Except probably after that one, she just went for one more and stopped. But as long as you're still putting to bed, you're still within your childbearing years and you want to have more children, there's a tendency that somebody who has had it before may likely have it again. So these are the predisposing causes: blocked fallopian tubes, smoking, PIDs. Please look out for yourself.